it's on, obviously. Yes. So what are your thoughts in regards to you're seeing an influx of people seeking private assistance, an influx?
I definitely see a number of persons coming into the office who will express frustration with various aspects of care in the polyclinic. Some of what Andre would have mentioned. So definitely you see that. We may have a little more opportunity or a little more time to spend with the clients working through, because we don't see as many as in the polyclinic. I worked in the polyclinic system for 14 years, so I know how hectic it can get in there. And unfortunately, sometimes it became like a conveyor belt system, in, out, and not enough time to work through persons' various problems. We even had to, just before I left the system, we even had to increase the length of time between persons' appointment visits, which wasn't ideal. And you try to do it as safely as you could, but sometimes you put persons at 6 months appointment who ideally might still have benefited from a 5, 4, or even the more typical 3-month appointment. But the primary complaint that you get when persons come over is, not the time not seemingly being there for their various problems to be adequately worked through. It's more about getting them a prescription and on to the next person.
Okay. There was some talk, and well, there's a whole flare in terms of cardiovascular situation. It has to do with diet. It has to do with biology. What so, the whole surge is about.
Combination of factors. Definitely the high prevalence of the chronic non-communicable diseases in Barbados is a major part of that. Yes, family history also plays a role in that. If you have a particular family that has a higher than normal cholesterol level, which may be definitely genetic, then that particular family may, are likely to have higher incidence of heart attack, strokes, and related cardiovascular diseases. But then the lifestyle aspect, that is to say, persons who are, maybe over their ideal weight, who have high blood pressure for various reasons. And there are a lot of reasons why a person's blood pressure may be high. But these chronic non-communicable diseases, diabetes, hypertension, high cholesterol levels, when they're not well controlled, over time, absolutely increase heart attack, stroke, and other cardiovascular diseases. So it's the lack of control on that. The point needs to be made that quite often these diseases are diagnosed late. At the point that we see the person in the office and they have met the diagnostic criteria to be called hypertensive, most of the time we are unaware for how long this person was hypertensive. They could have been hypertensive for 5, 10, or even 15 years before. And the implication of that being that that's time that the circulation throughout their body, what we call the circulation tree, has experienced some like irreversible changes. So even if we got really good blood pressure control now, or blood sugar control now at this moment in 2025, we can't undo what happened for the last 10, 15 years. So early diagnosis is key.
Understood. Yes, thank you very much. Dr. Hinds, yes. I know as